We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. Welcome to the Healthcare Revolution podcast. Today we are talking about returning to the gym. If you have joint pain, if you have things that are limiting your ability to get back to the gym, every year we have millions of people who decide this is the year for me, that I'm going to get back into shape, I'm going to get back into exercise, get back to the gym. And we are here to offer our top tips for returning to exercise with specific issues, with injuries, with things that are hurting you, and just kind of restarting your exercise plan, especially after you've had a long time off and you're just thinking new year, new you. We want to help you figure out how to navigate that, give you solutions, give you tips that are going to help you be the most successful to be able to engage with that at a high level. So today's episode is very different than we've had in the past. It's not about chasing resolutions, but we're building realistic, sustainable movement that you can create for long term. So today with us, we have Alyssa, and she is a doctor of physical therapy. She is all about keeping the adventure alive, and she has a global audience on YouTube, on different platforms, and we're so excited to have her on. And she is an expert in this area and helping people keep that adventure right at the forefront of their lives and giving people confidence. She specializes in rewriting the story of arthritis, of joint pain, of anything that's limiting your ability to exercise. So we're so excited to have her on, and welcome to the podcast again.
Thanks, Brad. I'm very excited to be here.
This is such a fun topic, especially as we close out the year. A lot of people's minds are going to New Year's resolutions, and they want to get back to the gym and make some changes. But we see so many people go back to the gym, and then a month later, those kind of goals die off. Give me some of your kind of top thoughts on what limits people's ability to stay in the gym.
I think one of the biggest things is going too hard too fast or doing too much right out of the gate. And then it can lead to pain, stiffness, injury. And then that can be very discouraging because it's like, oh, I'm trying to do everything I can to be healthy. Maybe they see some exercises online or something like that and decide to try something, and it ends up not being what they need or ends up being too hard. And then they start to feel not great. And it's like, well, then I can't exercise, or my body maybe just isn't ready for exercise. And then it kind of just goes to the wayside. Well, I just need to rest. And then that rest turns into a prolonged rest. And then you're just avoiding.
It's so challenging, right? I think of the classic example of someone that hasn't played football for 10 years, and then they go play the Turkey Bowl. And my wife works in the emergency room, and she tells me all these stories and people coming in getting hurt around these typical things, right? I'm sure if you were to rate how many people get hurt on Thanksgiving Day with the Turkey Bowl, it'd be a large number, right? But why is it, when we understand anatomy in the body, why is it that people get hurt when they do things too soon?
Well, I think it could be a few things. One, they try to go back and do something that they used to be able to do. Or maybe even lift the same weights that they used to. Oh, a few months ago, I squatted this, or I was doing this. So they go and grab that same weight or try to do that. Another thing is, when you're feeling extra motivated, like, oh, I'm really ready to lose weight, or I'm really ready to get stronger, and then you kind of go all in. And I have a lot of people who come to me that are like, I'm one of those people that it's like all or nothing. And I think that is one of the hardest things, because you're feeling you want to capitalize on this motivation, but then in turn, it turns into be too much too fast. So like you're going to the gym every day, or you're exercising every day in some regard when you haven't really exercised in a while. While exercising every day could be great, it might be too much too soon for your body. I think a lot of people try to do everything all at once to say, okay, you know, I want to really lose weight. I want to really go all in. But then they start to do so many different things. A lot of that turns to, I need to do something high intensity in order for it to be effective, or I need to do something for 60 minutes.
That is such a common thing that people say.
In order for it to be effective.
I gotta get my heart rate up to 175 and be sweating bullets for it to be effective.
Yes.
And why is that a problem?
If your body is not necessarily ready for that, whether it's intensity or duration that you're exercising for a long time, it starts to break down. And especially as you get older, it starts to break down a little bit quicker, or maybe you don't recover as fast, or maybe your body needs a longer warm up than you're typically used to. So you have to, and a lot of people just blame that on age. I'm just getting older. I can't do that. But no, we have to listen to your body. Okay, maybe you need a little bit longer to warm up. Maybe you need a little bit different movements in order to warm up. Maybe we need to alter a few movements that you're doing in your exercise, that if something doesn't feel right, you need to be able to adapt and modify and not turn that just immediately into frustration of, I can't do this, so I'm just not doing it. And then you can fall down into the rabbit hole of, I'm just not going to do exercise at all.
Because exercise causes pain, therefore I should not exercise.
Yes.
And whether we say that verbally or unconsciously, that's the message our body starts to recognize. Because every time I exercise, my body hurts. Therefore, I should not exercise. But we all know that research shows that exercise is literally the best medicine in the entire world. There's no better medicine out on the market than just regular exercise. So tell us about, we've talked about joint pain in the past, but say someone gets back to the gym and their knees hurt, their hips hurt. What goes through your mind as a doctor of physical therapy, and how do you explain to them what's happening?
Well, and I like how you just mentioned medicine, because I think that phrase gets thrown around a lot, like exercise is medicine. And oftentimes, I don't think it's necessarily interpreted in the right way, meaning exercise is medicine, but you also have to look at it as medicine. So like if you have a certain condition, you take a certain medication for that. And that medication is not going to the store, having a shelf of medication and you just grab one. It's not all created equal. So if you need a specific type of medication, you need a specific dosage. And exercise is the same way. Not all exercise is created equally. Like you have to be able to have the right dosage. You have to be able to have the right repetitions and the right type of exercise. So you have to take it a step further. And I know that a lot of times it's hard. Like if you're dealing with knee pain, you're not from a background of physical therapy, from exercise. Okay, what do I do? Well, sometimes just like medication, not every medication works right away, or not every medication is the right one for you. It's a little bit of trial and error. And I think people don't have a lot of patience in terms of when they're dealing with pain or in terms of exercise, because exercise is hard. And if something doesn't work right away, then it just kind of gets thrown to the wayside. So I think having patience and going for simplicity first. That if you're dealing with knee pain, hip pain, and you're trying to do a weighted squat or something that you typically have done, that might not be what your body needs at that time. So you need to be able to listen to your body. Even if you've done that
in the past.
Yes.
It's like, well, I did this 3 years ago.
Yes.
Right? Your body adapts to the load you place upon it. So if you haven't squatted in 3 years, your tissues, whether they be your joint, anywhere in your joints, your ligaments, your tendons, your muscles, they're not used to that load. All of a sudden you give them a load and it's like, surprise, they hurt, right?
Exactly. But then it's like, oh, I can't squat anymore. And then it turns into this whole cascade of, well, maybe I can't lift weights anymore. Well, maybe I just need to walk, or maybe I just need to do like very light exercise. And a lot of people are so hard on themselves when they can't do something or something doesn't go quite as it used to. especially as you get older, it's not, you can't exercise at the same intensity, or maybe you can't do the same exercises. It's okay, how can we change these so you can? I mean, even when I go on, a vacation or something and I don't work out for 2 weeks, I'm not going back into the gym squatting the same amount of weight I was, or I'm not doing maybe the same amount or the same exercises. I'm taking that as, okay, this doesn't feel great right now, or I know it's not going to feel great. So I need to do something to change that. That doesn't mean I'm like lesser of a person, or maybe that I've lost progress or I'm back to square one. It's no, I'm just listening to my body, so I'm not paying for this later. And it's not the point of you've lost progress or you've gone backwards. It's taking that communication that your body's giving you and actually doing something with it instead of ignoring it and then paying for it later.
Yeah. I want to refer to the study that we include in this podcast is from Turner and his group. It talks about resistance training leading to very meaningful improvements in pain and physical function with people with knee arthritis. So a lot of people think that my joints hurt because of arthritis, whether you have a diagnosis of arthritis or not. My joints hurt because I have that. But physical exercise, progressive, right, making the dosage with what you need, can be very, very meaningful and actually can decrease your pain significantly. And also, you've talked about in the past the importance of variation in exercise. A lot of times we do the same movements all day long. You sit in a chair, you stand up, you walk in one plane of motion, right? What about sideways? What about backwards? Your joints really need variation of movement because your tissues adapt based on all these demands. So if you're consistently wearing, I like to explain to patients, a tire going down the road that's imbalanced, and you're wearing on that same portion of the tire, it's irritating that same portion of the joint, right? Rather than spreading out the load and getting that variation, you're maybe wearing on the same area over and over again. Or like an Indian burn, right? You rub one spot enough, or someone scratching your back, we've all had that, right? Scratching the same spot over and over again, it gets a little irritating, right?
Yeah.
But if you use the whole back, it feels pretty good.
Yeah.
Tell us
absolutely.
what you would add to variation of movement.
I think adding variety to movement is obviously very important, and it gets, I think, neglected or ignored because, again, it comes down to simplicity. It doesn't have to be complicated. You don't have to look up all these exercises online. It's move sideways, whether that's walking sideways, literally waiting for something to cook, waiting for coffee, stepping sideways. No matter what age you are, no matter how fit you are, that can be so effective. And it's actually kind of interesting how quickly your muscles fatigue, especially if you don't really do it very often and you think, oh, I'm strong, I'm fit. It's actually quite alarming and surprising how quickly those muscles can fatigue because you're not moving in those directions. Or it's walking backwards. I love it when I'm out in public and I see people walking backwards. I think it's like I saw someone, we were hiking the other day.
Most people think they're crazy. You're like proud of them. You're
yes.
Like, yes.
Well, even some of the followers and subscribers are like, I saw someone walking backwards the other day and I knew why they were doing that. Like now I get it. And so it's taking it back to not making it super complicated. You don't have to go and do, lateral lunges and do all these different things. Sometimes it's just simply moving sideways, moving backwards, moving in a way that you're not typically used to. And I think this is one of the most important ways that you can start to become consistent with exercise. When we're talking about, new year, trying not to drop off after a month or so, being consistent with exercise starts small. Don't set a goal for yourself to exercise every day for 60 minutes at a time. Say, I'm going to move purposely for 10 to 15 minutes a day. And that can look so many different ways depending on how fit you are, depending on your exercise background. If it's limited, start by moving sideways, moving backwards, doing a few squats, holding the kitchen sink. It doesn't have to be super complicated. And honestly, I think that is the biggest thing that can help to unlock consistency, that you can do things that actually make your body feel good, not trying all these hard exercises, feeling like crap, but then trying to push through it and ignore it.
And I want to add a piece a little bit more on, why my joints hurt anatomically speaking and physiologically, right? So we did a bed rest study in PT school where we put college students in bed for 7 days. Micah Drummond was the researcher, and I was just a part of the project. Bobby Briggs, if you go back to, what would that be, 6 years ago? So 2019, 2018, I think is when it was published. But we put college students in bed for 7 days, and we wanted to measure how much muscle mass they lost in their thighs within a 7-day period. This is complete bed rest. All they could do is stand up to a bedside commode, just a little toilet on the side. They couldn't take any steps. Then they had to immediately go back to bed. And we paid them to just sit there, and they could do whatever they want. And we measured their intramuscular tissue. So my job was to trace on an MRI how much muscle mass they had and figure out how much fat. And then we do pre and post, right? Before the study, after the study. And then also I would test them with pushing against like a leg press machine to see how strong they are, or a dynamometer is what we actually used, which measures how many pounds of output you can do with your quads, how strong they are. And most of the participants in this study lost up to 3 pounds of muscle mass just in their thighs. And then their strength was decreased by some up to 50%, most around 35%. So these are young college students we put in bed for 7 days. We're just talking a week. What happens to the body? The body literally changes based on the demand you apply upon it, right? Its job, its default, it's consistently break down. And a lot of people are like, well, why would your body break down? Your body has to break down to build up, right? If you get a cut, that's how it repairs. So your body has to consistently break tissue down in order to get stronger and rebuild. So if you're not constantly telling your body to build, it's constantly breaking back down, right? So we're talking about, okay, you haven't been exercising for 3 years. You were an elite athlete back in high school, right? And your mind is like thinking, young athlete, I'm going to go hit some cleans and some deadlifts and, back to the weight that I did in high school. But your body is going to hurt like crazy because you have not adapted the tissues or your joints to that load anymore. They've essentially broken down and got weaker and more viable, you could say, right? Just very sensitive, right? And the people that have the strongest joints, the strongest cartilage, the strongest discs in their spine are weightlifters, right? And why is that? Because of load, right? What would you add to that?
I think it's kind of stemming from that is I think we also overestimate how much activity we're doing. So I get a lot of people who are like, I'm active, I, do things. But when you actually look at it in terms of, okay, are you actually providing your body the load that it needs, like you were just talking about? A lot of people consider running errands, doing daily things like, oh, I stand up and down from a chair, 10, 20 times a day. I don't necessarily need to do any more than that. I'm out running errands, getting in and out, walking. I'm being active.
Climb a ladder all day at work. Yeah.
I'm being active. But your body acclimates to that. Like that is a normal occurrence for your body after you've been doing it for, a few days, few months. So your body is used to that. So that is not adding any extra load to what you were saying. So it comes back to, I'm going to be purposeful about my exercise. I'm going to do my baseline activity, the things I typically do. That stuff, can add up to a certain extent. It's better than sitting doing nothing. But if you want to prevent this breakdown, even maintain what you have to do something more than what your body is used to. And so I think if you think about it in that way of I'm going to add 15, 20 minutes of purposeful movement into my day. And that purposeful movement is going to look different for the both of us, depending on your fitness level, what you typically do during the day. And it's going to look different than, say, someone who is 70 and listening. It doesn't have to be going to the gym every day and lifting weights, but you have to do something that your body isn't necessarily used to. For example, add 10 to 20 squats to your day. Your body's used to standing up that many times, but if you add that additional, that's doing something that's purposeful. And depending on where you're at in your fitness journey, you can add on to that. For me, that's going to the gym for 40 minutes a day and increasing the weight I'm doing squatting or increasing the weight I'm doing with some of the dumbbell movements. But I'm also trying to add on top of what my body is used to. So I think if you think about it in that way, it brings a little bit more of that simplicity because you have to do something more than what your body is used to. And or else you're going to have this breakdown. You're going to have this, it's actually quite alarming how quickly you can lose strength, you can lose muscle, and how long it takes to build it up, or how long it feels like it takes to build it up. So if you just start framing it in that way, I think it becomes a lot more approachable. And it also looks different depending on who you are.
Yeah, I love the analogy of building calluses on your hands. You think about a little child on monkey bars. You know, my daughter, I've talked about in this podcast before, but my daughter came home one day and I felt her hands. I said, "Why are your hands so rough?" She says, "Because I do the monkey bars every day." And she was 6 at the time. And I said, "Did any of your friends do it as well?" She's like, "Oh yeah, my friend did it." And her hands were bleeding because she hadn't been doing them every day like me. And I love that analogy because that's kind of how our bodies work, right? If we do too much too soon, you imagine doing the monkey bars as an adult and you haven't done them in a long time. If you've ever tried that, go try it. It can be really challenging. You're like, "Oh, I did the monkey bars easy as a kid." Go do it as an adult. Your grip strength isn't used to that. Your shoulder joints, your ability to be able to hold up your whole body weight, it's very different. It feels very different. Right? And getting back into pull-ups or getting back into monkey bars, if you're doing them with your kids or just for fun, you have to do it gradually. It's just a little bit at a time. You know, just start with the small things, start simple, and then build up, just like how you would build a callus. You can't do it overnight. You do it gradually over time. And that's how your tendons develop as well. Your joints, your cartilage in your joint, they literally get stronger as you apply appropriate demand, just like calluses on your hand. I had a patient the other day that came in and she had tore her bicep tendon, and she didn't have any mechanism, like she didn't do anything. She's like, "I have no idea how I tore this." And this is decades of minimal exercise, right? And who knows what happened, but essentially we know physiologically when you don't strengthen a tendon, it gets weaker and weaker, and you could imagine softer and softer, and it doesn't take much to damage tissue. So why do we work out? Essentially to reverse that. And no matter what age you are, you can reverse it. You know, I have a 75-year-old gal that works out at CrossFit with me every day at 5:30. She is there every day. And you know what she does? I love her. She has her own modifications for every single workout.
Yes.
We're over here doing 24-inch box jumps like crazy. She's over here with her 10-inch pad and she's stepping up. And I'm just like, she is awesome, you know? And
because
it's so
also
cool.
being able to recognize that, like, okay, I might not be able to do XYZ over here, and being very smart about it and listening to her body and doing the modifications without feeling like she's lesser or that it's not going to be as effective, when in reality it is. But it's being able to have that perspective and also be able to accept that and continue on.
Yeah.
And I wanted to touch on what you were just talking about how your tendons adapt and how your muscles adapt gradually over time, adding this exercise. Your bones are the same way. So I have a lot of people who come to me with osteoporosis, or
Tell
they
us what
want
that
to,
is.
it's essentially bone weakening. So as you get older, your bones tend to weaken, just like how your muscles do. But you can mitigate that, just like you can increase your strength, you can increase the strength of your bones. But again, you have to have the appropriate load, the appropriate pressure, the appropriate essentially challenge to your bones in order for them to become stronger. They're not just going to become stronger just from doing your daily movement, what your body is used to. You have to take it that step further.
And if you want a good study to look at with that for our listeners, the Lift More study. If you Google Lift More, is an amazing study of how you can reverse osteoporosis, especially it seems that we do have more females, older females that have osteoporosis. Males can get it as well, but a lot of reasons for hormonal changes, stuff like that, menopause. But that's a great study to refer to if you want to get into this. Keep going, what you're saying.
So I think it's, again, a lot of people are asking, like, how can I increase my bone strength? Like, or how can I maybe prevent bone loss, or I have osteoporosis in my family, et cetera, et cetera. And it's, again, doing something more than your body is used to, being able to add this extra load. Daily life isn't necessarily going to do that. You have to take it a step further. And there are lots of different ways you can do that, but it's along the same vein of, as you're getting stronger by doing progressive exercise, you're also helping your bone strength as well. And it's funny, I see now a lot of people walking around in weighted vests. I don't know if you've seen that just in your neighborhood. And I think it stemmed, I think, a lot from social media, a lot of people seeing other people doing it. But I think the interesting thing is most of these weighted vests are 5-10 pounds, and that might not be enough.
Not stimulus. Well, it could be for some, but not enough for others, right?
And then if you're wearing the same weighted vest every single day, your body's going to get used to that. Now, I'm not saying go out and get a 50-pound vest and, walk around.
Yeah, everyone's going to be walking around with 50-pound vests now.
But there's also, like, your body adapts. So you have to be able to constantly increase the challenge. And walking with a weighted vest, yes, adds weight to walking that your body's currently used to. But once your body gets used to that, you have to be able to do other things. And that's where, like, jumping, and I don't want to go down a tangent of osteoporosis, but when you're finding the right exercise program, when you're taking care of your body and really paying attention to these things, not only are you getting stronger, but you're also improving bone strength and improving a lot of other aspects that aren't just, the number on the scale that you see that you're losing weight. There are so many other benefits that can really help drive forward.
So a lot of people do get caught up into that, right? Like, it's like, I just exercise because I ate that cake, or I want to lose weight. There's so many other benefits. Like, that is just a small portion. And you got to exercise a very specific way to lose weight. And getting some help with that and some guidance can be really helpful. And that's not the purpose of this podcast. But ultimately, we want people to know that your body is an adaptable machine. And how you program it is the output that it gives you. Your body is not like a car that just breaks down over time. It literally will change based on the stimulus or the stress that you place upon it. And it has to be an appropriate stress. If you add too much too soon, you're going to get soreness. You're going to get joint pain. If you add appropriate amounts, your body adapts over time. And the most important thing I hope people get out of this is consistency is everything. You'll get more benefit from exercise if you're just consistent than if you go super frequent and super intense, because people get way too intense and it's like, oh, I need a couple weeks off because everything hurts, right? But if you can just start small, right? I love your videos of people sitting doing their dishes, stepping side to side at their sink, right? Maybe doing some calf raises at the sink, right? Figure out ways where you can integrate it into your normal life, where it's not just your normal activity, it's other things that you're doing as well.
Well, and I think that's important too, especially in a generation that didn't necessarily grow up exercising, or fitness wasn't a big thing. Like, there are a lot of people that I meet and that I talk to that are like, I haven't exercised in, 30 years, or this is the first time that I'm actually, strength training, or the first time I'm actually doing like purposeful exercise, because it wasn't necessarily a big thing back then. And I think that's, again, where consistency is key. And if you're a person who doesn't necessarily like exercise, I love like kitchen exercises, doing these, short bouts of movement throughout the day. If you're going to stand up from a chair, stand up and down 3 times and then go do what you need to do, etc. Making it more of a daily routine can be a huge way to start to see progress, start to feel change. And when you start to feel that, like, wow, my body feels a lot better. I feel stronger. I feel more confident, et cetera, et cetera. My posture is better. Then that's when you get into the habit of movement is addicting, that I know how good I can feel, so I'm going to keep doing this. And I think just figuring out a way to add that purposeful movement into your daily routine first can be huge, especially if you're not a person who enjoys exercise.
Absolutely. And before we jump into the psychological things that people experience, let's talk about the plans that you do, both the free resources that people can look at, and then about the programming that you help develop for people.
So my main mission of my YouTube channel and Instagram primarily is simplicity. I want to show you that exercise doesn't have to be complicated and it can actually feel pretty good. And my goal for you is to do an exercise that I show and say, wow, that didn't hurt. Or wow, I can actually do that and not feel like sore afterwards, or et cetera, et cetera. So simplicity is key. And so I try to provide so many simple exercises. I like to explain why you're doing something so it makes sense. I'm doing this because I'm strengthening my hips because it's going to help my knees, etc. So I have a lot of free videos on Instagram and YouTube. I have some longer videos on YouTube, but the Instagram videos are nice and short. So just up to 30, 60 seconds. So
if you're listening to this, go check them out because they are so simple, because we overcomplicate exercise way too much. There's so many influencers in the world that are like getting really creative and cute with different exercises, and it doesn't need to be complex. You don't need to like look up this exercise that you saw on YouTube that like solves all back pain, right? That's probably not gonna happen.
Yes.
But what I love about your videos is they're so simple. It's like, try these exercises for knee pain, try these exercises for hip pain, right? Do you have pain with this? Try these, right?
Yes. And it's the idea that no matter what your fitness level is, these exercises can be helpful because you need a starting point. Like I have people who are my age who don't necessarily exercise a lot, but they're like, oh, I was trying these exercises and they actually feel pretty good. And so I try to provide as much simple content as possible, but I also want to put a little bit of education behind it, just because the more you know, the more powerful you can become. And so I have a lot of people who are spreading the word of, oh, I told my friend to walk sideways, or I told my friend to walk backwards, etc. So I think that's really cool. But I also have a paid membership where if you're looking for more targeted full body workouts, a lot of my free content are exercises that you can add to a routine.
There's so many helpful resources.
But it's not necessarily packed into a full routine. So if you want follow along workouts with me that are going to be in the progressive, like we were talking about, they're going to gradually get more challenging and I'm guiding you through it, then that is my membership, Adventures for Life.
And I want to just explain the difference here, because so many people don't understand the difference between just YouTubing a bunch of stuff and being with a physical therapist, right? Whether it be in person or whether it be a subscription that you're following. The main difference, I want to compare it to an eye doctor. I went and got glasses the other day. I haven't had glasses my whole life, but it was a pretty unique experience because I thought, well, why can't I just like try a bunch on, myself? Imagine you're going to prescribe yourself your own glasses. And you're just like going through the glasses store and everyone's a different prescription and you're just putting them on and you're like, nope. And then by the time you're just like dizzy, right? You're like, I don't even know if no glasses works now, right? But when the eye doctor you start looking at the screen and they're saying better, worse, the same. And then they're moving different lenses and helping you really quickly identify exactly what you need. That's what I like to think about your programs. It's like, this is a step-by-step approach so you don't get stuck. Because getting stuck is literally the hardest part.
Yes.
Because you might be following a lot of these resources and you're like, okay, I'm getting it. And then you do one that's just a little too hard and it hurts you. You're like, shoot, maybe I do need that surgery. But ultimately, maybe the dosage was just a little too much, just barely off, right? But what I like about the guides that you do is it's step by step. It's like, okay, here's the next step. And you don't progress too much, because one of the biggest things I see as a physical therapist that people do is they jump big gaps in exercise difficulty. So the dosage is way too high too soon, and they didn't realize they skipped 4 steps in progression.
Yes.
Right? It's like teaching a baby to go from crawling to now running. there's multiple phases in between. And we gotta slow it down, especially as we age, because the body doesn't adapt nearly as much. Is there anything you'd add to that?
One of the things that the reason why I created my membership like I do, there's, 6 levels and a bunch of different steps, going step by step, like you were just saying, because we want to increase the challenge gradually and make sure you're ready for it. But I also want to choose the right movements that I know are going to feel great for a majority. Obviously, there are some outliers, but for a majority of the people, every exercise I do, I take into consideration if you have hip pain, if you have knee pain, if you have back pain, and try to give modifications, because not everyone's going to be the same and not every condition presents the same either. And I think that's like, even when I'm scrolling social media and I see these exercises, and people will say, oh, if you have hip arthritis, try this. And I'm looking at the exercise, like there is no way someone with hip arthritis, or most of the population with hip arthritis, can even remotely get into that position.
Yeah.
And so we also use test to pass along the way to make sure that you are progressing in the right manner. So like if you do a few workouts, you'll have to pass a test of, can you stand up and down 10 times or something like that? And if you can, it's like, okay, well then you're probably ready to move on. If you can't, let's maybe stay in this step for a little bit longer until you're able to do that. So that's kind of where the physical therapy meshes in with these follow along workouts. And that's one of the main reasons why I didn't just throw all of my workouts into a workout library and say, here's 300 workouts.
And if people look this up,
Keeping
the Adventure Alive is where they find it, right?
Keep the Adventure Alive is my website, yes, and the membership is called Adventures for Life.
I love it. Let's talk about the psychological stuff that people experience, right? They put on their shoes, they got their new outfit, they're going to the gym for the first time, they get there and the gym membership is way more than they expect. They get in the gym, they're like, I don't know what equipment to use, like everyone's staring at me, I don't know what I'm doing, right? There's so many psychological things that come along. Give us kind of your best tips to overcome these things.
I think a lot of my audience does a lot of working out at home, especially for people who, didn't necessarily grow up exercising, don't really feel comfortable in doing it in front of other people. But I also think a gym can be motivating as well, because you see people from all fitness levels doing all kinds of different exercises. And so I think it just comes down to not caring what people think, which is obviously a lot harder or a lot easier said than done.
Especially if you're in a spot where you're like, oh, I'm vulnerable. Like, yes. I really don't know what I'm doing. This imposter syndrome, right?
I think classes can give a great option here of, you don't really have to think about the exercises that you're doing. You're following along with the instructor. I have a lot of clients that go to Silver Sneakers and utilize that, because it is also a social aspect as well.
Tell us what Silver Sneakers is.
It's they have a lot of classes at different gyms, and it's typically covered by Medicare. So they typically trend a little bit older in their demographics, but they have some awesome classes at balance, strength, etc. So it can be a great entry point, because again, it also is social. Like, you're meeting people, and there is a huge psychological benefit to being social and interacting with people. I think also it's coming down to doing some research before you go. I think sometimes people, just go to the gym and then try to figure out what they're going to do. Having a plan beforehand of what types of exercises you're going to do. I see people following videos at the gym, working out with somebody else. So there are some different strategies, but it could also be trying to work out at home first, really feel more confident in the movements, and really kind of understand how your body moves a little bit better. I really like that,
because you get kind of this introduction to exercise. Maybe you've never exercised before and you just were active your whole life, right? And it's like, this is all new. By getting into something at home, you start to get familiarized. Oh, this is called a lunge. This is called a squat, right? Maybe the verbiage is confusing to you, right? I love, as a physical therapist, when people are getting to the point where ending their episode of care. So say their knee is getting better. We work on building a bridge to the community. So all of our physical therapists go out in the community and go to these gyms. And their role is to get to know the trainer, get to know the programming, get to know the demographic of people that go there. And we keep a database for our clinicians so they know where someone would fit in the most. And we try to do this whole, what we call warm handoff, which, so one example would be a gym that we use in Riverton. It's called Stay Fit. And this gym is just filled with people anywhere between their 40s and 60s. Just not necessarily old people, but kind of that mid-age range, right? And a lot of them have never exercised before. So it's just like this demographic that's like great. And we connect the patient with the gym owner or trainer there, and they go for a consult, one-on-one consult before, talking about the gym, maybe some one-on-one personal training. And they get to go to the gym before their first time. They get to meet at least one person. So it's like this warm handoff. Will connect them on a text. They'll go in for their consult before they graduate their episode of care. And then they come back and they're like, oh, I'm really stressed about going. We're like, oh, this trainer's awesome. This is how they program. This is the community. You'll make good friends because everyone's kind of in that same age group, right? But we know all these different gyms. We know Burn Boot Camp. We know Burn Boot Camp's just filled with a ton of moms. It's really intense workouts. We got to build up your programming here so you're prepared for that. We'll even connect you with that trainer so they know where you're at, right? But I'm thinking about our role as physical therapists. But these are all great tips on, like, if you need recommendations, reach out to someone like us that can help you build that bridge. I think that'd be a great resource.
I think it's also important that if, say, you have knee arthritis or joint pain, joint stiffness, even going to a physical therapist and getting just some general exercise ideas, like kind of pointing in the right direction, especially if you haven't been to physical therapy before. I think a lot of people think they need to be injured or think they need to be, in a certain state of pain or stiffness seeking out a physical therapist. But if you would like some guidance, certainly in order for insurance to cover it, you do need some degree of pain, stiffness, etc., some sort of diagnosis typically. But there are a lot of cash pay clinicians out there as well. That seeking out somebody who can actually just give you some ideas and point you in the right direction can be great too, especially if you're someone who maybe prefers going to in person first and then figuring out from there where to go next, or getting some recommendations for like personal trainers and things like that, because with any profession, there are some that are better and some that are not. And if you get into a position where maybe you're working out with a personal trainer and it's just not going well, you're feeling sore, again, that's going to discourage you from exercising in general. So it's setting yourself up for success and utilizing community resources, utilizing other people, maybe what's worked for friends, etc., seeking out healthcare professionals, I think are all options you can use and strategies to help ease into exercise.
Yeah, I love that. Any other last tips as we wrap up this podcast for people that are returning exercise, that might be fearful, that might be worried about, but they're really motivated right now? Any other last tips that you'd add?
It's just start simple. Don't go too hot out of the gate thinking that that's what's going to jumpstart your strengthening. That's what's going to jumpstart your weight loss, whatever's driving you right now. Start simple. And honestly, do not underestimate the simplicity of it, because it is astonishing how many people, even just adding 10 purposeful minutes of movement to their day over a couple of weeks, how life-changing that can start feeling. That's like your gateway of then, oh, actually exercise can make me feel good. I'm going to keep doing it.
Yeah, I love that. And one of the measures that we give patients a lot as they're entering new activities is if your joints are stiff and muscles are sore any more than 24 to 48 hours, you pushed a little too hard. And that can be a good measure to figure out if this is like a red light, like we need to stop, proceed with caution or hit the gas, right? But I love what you say is like, just be simple. Like, just get to the gym. start with some light exercises, right? You don't need to go super heavy at first. See how your body feels after doing simple things, and then gradually increase. And a good recommendation, general recommendation, is increase by 10% per week, right? With load or intensity, but don't go out of the gate super hot.
Exactly.
I love your thoughts, and I love all the things that you're doing out in the community. Thank you for being on the podcast today, Alyssa. These are great tips for people that just want to get back to living their life, right? Keep the adventure alive. Keep being active no matter what age you are, and don't let your dreams diminish just because you're getting older.
Yes, and be purposeful with it. Don't consider yourself, wherever you're starting out at is where you're starting, and that is okay. Everyone's going to be starting at a different point, but you also have to be patient with yourself. That I think that's one of the reasons why people go too hard, too fast right out of the gate, is like, oh, I need to do what I used to, or I need to do what my friend is doing. Listen to your body and adapt accordingly.
Yeah.
It's hard not to compare yourself to others, but really, if you want to stay strong, stay fit, and stay out of pain, you have to listen to what your body's telling you.
That's great advice. Well, thank you for joining us on the podcast today, Alyssa.
Thank you so much for having me.